How are you doing, sir? Good to see you. God bless you. Well, good afternoon. Sunday, I was happy to be in Bay County. We did a great event vaccinating a lot of seniors in conjunction with a lot of churches, and I said I'd be back soon this week to be able to make an additional announcement, and probably not too much of a surprise given where we are now. We are announcing very excitedly that our partnership with Publix is expanding to include Bay and Walton counties. I announced earlier this morning that we are going to be in Escambia, Santa Rosa, and Okaloosa. So we have a lot of the panhandle covered at this point. There's going to be 3 of the Publix in Walton and 5 of the Publix in Bay. We'll be offering coronavirus vaccine shots to senior citizens beginning on Thursday. And so tomorrow, you're going to be able to go on Publix website and you can get a reservation, and then they'll start doing shots on Thursday. Each Publix that is in this program is doing about 100 to 125 shots a day. And so you can see throughout, there's a number of spots throughout the panhandle. Each one of those is going to have those numbers. I want to thank Publix for really stepping up. We were, as we started to get more vaccine, as the hospitals were vaccinating their folks, as the nursing home program was going with CVS and Walgreens, we really wanted to get into the 65 and plus population. We were the first state to put seniors first. I know some other recommendations were to put younger, healthy people first, but our view was we needed to put 65 and up first. And so that's what we've done. And we've done it in a variety of ways. Obviously, the hospitals are doing a good job, many of them, of vaccinating seniors in the communities. County health departments are doing an awful lot across the state, including, I think we have over 40 vaccination sites now in conjunction with county health. We also have things like drive-through test sites. So we converted part of the Hard Rock football stadium down in Miami that just had the national championship game into a drive-through vaccination site. So that's doing 1,000 shots a day through there. Even kept it open on Monday when you had the championship game. We had to close it a little early, but you kept it open. And then, as you know, in Bay County and others in Florida, partnering with churches, places of worship, to be able to bring a vaccine to the parishioners. So that's been good. But we also recognize not everyone can get to a drive-through site. It's a central location. We've got a big state. Not every senior wants to go into a hospital. And so the partnership with Publix is great because Publix, it's just part of Florida's DNA. It's everywhere in Florida. Everyone knows Publix. It's in all these communities all across the state. They got over 750 Publixes with pharmacies throughout the state of Florida. And so to be able to work with Publix, knowing that the vaccine will then be able to be distributed far and wide in these counties with the focus on senior citizens was a great opportunity. So we started it with 3 counties in the center part of the state, Marion, Hernando, and Citrus. And there were 22 Publixes with pharmacies that we identified in those 3 that Publix did. They started offering the vaccine last week, sign up last Wednesday, and then shots last Thursday. And they've been doing 100 to 125 at every store. I was able to go. I have Dane Rusk here as the VP of Pharmacy. He's been leading a lot of the application of this. And every single Publix we visited 3. All of them did it maybe a little bit differently because all the stores are set up a little bit differently, but it was very efficient. The seniors really appreciated it, and they were able to work through all their appointments without any problems. And so this has really been successful. We're really gratified to be able to announce the expansion of this program here in Northwest Florida. So again, you can sign up starting tomorrow on the Publix website, publix.com/COVID vaccine. They have the information on how you can go about it. And I would just remind people, we have 4.4 million seniors. Now we have done 350,000+ seniors have been vaccinated, and that number is growing rapidly every day. But there's still going to be more demand than appointments. Rest assured, they're going to book appointments. As we get more vaccine, we're going to be continuing with this. I mean, this is something we're committed to, and we look forward to doing that. So tomorrow you can make the appointments. Thursday you'll start going. They do it through the weekend, and I think that they're going to be able to use, and we obviously are giving them more vaccine apart from those other 3 counties, which is really, really good. So thanks for Publix for stepping up and doing this. And this is really, I think, an exciting expansion. If you look, we're the only state in the country that's done a majority of our vaccines with senior citizens. Some haven't even done like 10, 15%. We're putting seniors first. Now the CDC is telling other people that you should do 65 and up. That wasn't what they were saying 6 weeks ago. But we from the beginning thought you had to put seniors first. So we're going to continue to do that. You also look at how the numbers grow. These things take a while to get reported. Look at last Wednesday. There's almost 70,000 vaccinations have now been reported for that day. You looked at it last week, it would have been 52. It's still a lot, but it's growing. There's more and more. You're going to see it. And I think you're going to see the same thing this week going forward. And so we are proud to be leading the nation in vaccines for seniors. Not even close in terms of the overall number. Obviously, we have a big population. But even as the percentage of vaccines, we're way ahead in terms of focusing on our senior citizens. So that is our commitment. That is what we're going to get done as we get new vaccines in. And as more and more seniors are able to get vaccinated, you'll start to see maybe the demand taper off a little bit. But that's not going to happen today or next week. There's a strong demand for this. Seniors want it. And I tell you, just when I was in there, we were there over the weekend with the Publix guys. A lot of these seniors are tears when they're getting the vaccine. Some of them have been, they haven't been able, they're mitigating, they're not living the same life that they did prior to COVID. And so now this is something that people have been waiting for, and you're getting it. And they're delivering it here at Publix. And so you have those pharmacists I've been talking to. It's a little bit different than some of the other shots. Not that they're not important, but this is something that really is having a positive impact on people's lives. So we're going to keep doing that. We're going to keep working hard to be there for our seniors, and we will be announcing more initiatives with Publix very, very soon. So stay tuned. But if you're in Bay and Walton County, this is going to be yet another way for you, particularly our seniors, to be able to have access to get a coronavirus vaccine, and I'm proud of doing that. Anybody have any questions? Yes, ma'am.
Governor DeSantis, when it comes to the second vaccine, I think people are concerned with that supply issue and the timeline to which they need to get the second vaccine. What would be your response to that and those concerns?
So as of right now, there should be zero concern, because every time we get sent a shot, the federal government's holding the booster in reserve. So when you do with the first week, they were doing some of the nursing homes, and they were doing the nurses and doctors. Whatever was sent, whatever was used, there was more sitting there, and then now that was sent. So if I say we get 250,000 this week, that's initial doses. I'm not talking about the booster. So that is how it's been. No shot, no dose that's come in Florida does not also have a corresponding dose somewhere else. Now, the question is, CDC or HHS is talking about maybe saying, we don't have to hold every dose in reserve because more and more production's happening. So let's get more forced doses out there. Still doing the booster. You're not walking away from the booster, but instead of it sitting in a warehouse somewhere for 3 weeks like the Pfizer, use that, and then as new Pfizer comes in, send that for the booster. So I think that they're going to put out some guidance on that, and I know Biden's talking about going that direction. But I can tell you, and we would probably do that too, but I can tell you, we're committed to the 2-dose regimen. It's 95% effective in these clinical trials. The first dose does help you. It does give you protection, but it's closer to 40 or 50%. And so you want to get the booster shot. I think that makes the immunity stronger and more durable. So we're going to do that. And I think what would happen is, if you then go to a situation where we don't necessarily want to hold all the second doses in reserve because we want more people to get their first, as we get in, Moderna's 4 weeks. So the production is getting better and better. So by that time, I think most people are confident that there's going to be more shipments coming into the States than there are right now. So I think you'll be able to work it out. But people should definitely rest assured that our policy in Florida is to get the second dose. I know Britain has talked about just doing everyone with 1 dose and just doing the 50%, and that's enough. we believe the second dose. And then as we get into hopefully sometime in February, late February, if the 1-dose Johnson & Johnson vaccine is approved, then that's only one shot. And then you'll be able to give that out to folks, and it'll be much easier to do.
Is there a timeline on when the vaccine could be administered to other members of the public?
So the timeline for that is we're going to do our senior population first. And if you look at the clip that we're going at, I mean, if we're doing 60, 70,000 in a day, I don't think every senior in Florida is going to actually want it. I think most will. And hopefully we can get more than that. So as we get that done, then we can move on to the next. But I think what you're going to see, so there's a lot of states that have been doing like kind of general workers and younger workers and all that. And then now they're doing 65 on top. The problem is that's going to create a massive bottleneck. And someone on their smartphone is going to be easier for them to make an appointment than someone that's 75. So I think you got to stick with seniors first. We'll get through that, and then we'll move on to the other parts of society.
Can you tell us again how many Publixes in Bay County and neighboring counties will get the vaccine?
Sure. So if you start the entire Northwest Florida, there's 6 in Escambia, 5 in Santa Rosa, 7 in Okaloosa, 3 in Walton, and 5 in Bay County. So that's a total of 26 Publix in Northwest Florida, each doing between 100 and 125 shots for seniors every day. And so if you look at it that way, yeah, we could maybe build like one mega site like right here, but I mean, you'd have to have people coming all over. It's dispersed more. It's in the hands of people who do this every day and know what they're doing. And I think it's in an environment that a lot of seniors have confidence in, because you're coming here to shop. People do that all the time. And like I said, we're I mean, everywhere we've been, people have been very, very excited to be able to get this. I mean, I was at Hard Rock Stadium when we opened that, and people were just really excited. I was at the Villages retirement community this morning. We launched a drive-through site. Now, normally they go through with their golf carts there, but it's so cold. Most of them were in their regular vehicles, but they were just so happy. And the Publix seniors who came in, so happy with how professional it was. So I think this is really, really good. I think getting it into the communities on a more micro level, doing the 100, 125 a pop, and this is, so we're adding 5 counties to the 3, and then we're also going to make an announcement very soon about even additional counties.
How can you guarantee that people will get their second shot in a timely manner?
Well, like I said, I guarantee that the federal government is holding back the second dose as of right now. So that's what they've chosen to do. And, I think that was probably the right decision, because you didn't want to be in a situation where, you want a vaccine and you're eligible, and then they're saying, no, I got to wait. I don't know when the supply's in. So I totally understand why they did it. But I think it's just a question of, they know Moderna, they know Pfizer, they can talk to them about what the production looks like. If it looks like the production's going to be much better in February, then I think you could have confidence that there's going to be enough boosters as addition to initial shots. But right now, as I said, every single shot that's come into Florida that's been applied, the feds have held the boosters. And so when the series is complete and that's reported, those are additional shipments on top of those initial doses.
With regard to local health departments, I know that some of them are having issues as well with the supply. Our own appointments fill up within 5 minutes.
Oh yeah, no.
Of that coming on, you kind of touched on that. People are frustrated with that. When do you foresee more supply coming to health departments in general?
Well, it'll be the same type of thing. So we actually had some health departments that were not really going through as quick, and so those were moved to health departments that were going through it quicker. And the health departments, many of them have been instrumental in some of these drive-through sites and some of the other community sites, which have been very, very good. So yeah, we want to continue to get there. But basically, after the first couple weeks, where it was nursing homes and hospitals, they started to get the county health departments. And so really last week was really the first week they all had some vaccine. And so now we're in a spot where we can identify who's using it, who's not using it as efficiently. And look, if you have vaccine and it's going to take you 2 weeks to get through it, okay, fine, but I'm not going to then send you more if someone else can get through it in this week. But I would also just tell people, don't get frustrated if you can't get an appointment. This is like like the new iPhone times 10 in terms of just crushing demand. I mean, it melts phone lines, it melts these reservation systems. You got to do all, I mean, Publix does a good job of managing that. So, but I just say hang in there, because if I get more vaccine dropped, we want to offer as many appointments as you can soon. So if you didn't get one for this week and more vaccine, you may have an opportunity very, very soon. But we're not going to stop until, you know, every senior has an opportunity to get it. Look, no one's forcing this, no mandate. But if you want to get it, we want to get it to you. So this will increase the availability in Bay County and the surrounding counties very nicely. And we're going to continue to see that in other parts. So thank you, guys. Hopefully I'll be back and can announce even more good stuff for Northwest Florida.
Thank you. Great
Yeah, thanks, guys.
Thank
Good
you.
to see you. Yeah.
Go Florida.
So good to see you guys. Thank you so much. Which way are we going?
Thank you so much for your good leadership.
Yeah, yeah. Thank you. Thank you.
Well, I admire that.